according to our experience of all these years, I personally believe, and this is true, that up to 90 to 95% of denials are preventable. You do not have to receive a denial and then fix it. There are ways you can prevent the denials from happening. So when we are reviewing your previous billing, we are also identifying what are the top 10 denial reasons or top 10 rejection reasons that has been happening over the course of the last 12 months. And here are the proposed solutions.
Fred, thank you so much for hopping on today's podcast. Excited to speak to you today and learn about the end-to-end RCM work you're leading at MediBillMD. First, to get us, started, you've been with MediBillMD since the early days, I think over 4 years now.
Yeah.
What's the backstory behind that, and what inspired MediBillMD's focus on precise billing and transforming RCM?
Thank you, Bert, for having me. Thank you for inviting me. It's very exciting to be part of this podcast. So, yeah, back in the day, I think 2019 is when we started giving it a thought. Wanted to get into this healthcare industry somehow. I think revenue cycle management was something that we were really interested in. And I had background as well. I was working with a couple of other companies back in the days, 2018 and before. So there were some things that I identified that could have been done different, because I think revenue cycle management is being done incorrectly. And then you get people sitting at the top, not ready to listen sometimes. And you have that urge to do things different because now you've gained so much experience and you work with so many different insurances and different type of practices and different type of setups. You want to suggest something. But I got to a point where I thought, I have to do something where I could, bring a bit of change in the overall market. So 2019 is when we started as a telemedicine service provider. So that was an easy entry just because it was COVID and all, and people looking for platforms for video consults. We explored the options of integrating with different EMRs to provide Zoom video consults and stuff. That worked to some extent, but ultimately our goal was to get into the revenue cycle management side of things. So we gave it a kickstart. I was the only person sitting in the office. Now we have 750. So I started making calls here and there. We started our SEOs and all the marketing stuff that you have to do. And we landed our first customer in the first week. That customer is still with us and they're doing pretty well. So that's a success story, of course. So it's just that I wanted to give the society and the people in this domain and people in this industry that revenue cycle management is probably handled not the way it should be handled. So when I speak to my clients, I give them that personal approach to things, handling, like handcrafting every claim while using a top-notch tech that is usable. So the entire inspiration behind this was just to have that ability and freedom to do the things the way I think that would make more difference and probably enhance practices' revenues. And so far it's been working. We've got almost 175 revenue cycle management customers, and pretty much the same on the credentialing side because we're end-to-end credentialing as well. And that's another topic. So I think pretty solid customer base. We've got very solid 97 and 98% retention rates, and we've got good reviews coming as well. So yeah, and we are very selective picking our customers right now because it's difficult when you are a Rolls Royce of a billing company because you're making everything with your own hands. So you have to have enough manpower to do that. So very, very selective and cherry picking the customer. So that's our approach. So that was the inspiration.
I love that. That was a great overview, and the numbers. A testament to the great work you guys are doing. 87% retention and 187 RCM customers. It's certainly impressive. I want to touch on the point you made about RCM is not handled the way it should be handled. What are some of the biggest challenges or roadblocks that you see today across practices that make it such that it's not being handled the way it should be?
There is a very common question or concern when we go into the sales call trying to speak with clients, and when you ask them what are your main pain points, what are some of the reasons why you've decided to switch your billing vendor, they come up with these concerns that there's a lot of stuff that is pushed back to us. There's a lot that we have to do. And when we actually manage to bring them on board and we log into their practices and I see line level items which are being sent to them, if somebody pays a little bit of attention to those problems, they're resolvable by just one click. But they just sit there compiling piles and piles of claim outstanding and compromising practices revenue that could have been collected in a matter of a week or so. Now they're aging in 90 plus and 120 plus of aging buckets, closing to the timely filing expiration, turning into lost revenue. So that's one of the biggest challenges. So I always thought, as a billing company, if you're supposed to bill a claim, your responsibility is not just to have the claim sent out. You're supposed to get it paid and settle, balance the ledgers, and close the account. That's when you're doing a good job. So because when you don't have the capability or the manpower, because you're so reliant on the automation and stuff, you're not willing to give patient a call and probably ask them what their updated insurance is so that you could correct it yourself and resubmit to the insurance. Now you're waiting for the client. You've just sent it to the doctor's office. They don't have time to call that patient and obtain the information. The patient's not available, and that claim is going to sit there for eternity. And now you've just turned that into a lost revenue. So I think the holistic nature of revenue cycle management that we offer, which is an end-to-end service, is probably the solution some of the larger practice, even smaller, would look for. One of the other biggest challenge is obviously the availability of human resources. I brought some numbers. The shortages in healthcare workers is going to be 3.2 million by 2026. That's the billers and coders within the United States. And I'll reference the source as well. And one of the other big number is the outsourced medical billing market has grown up to, or is going to grow up to $32.98 billion by 2032, which means the clinicians are, admitting the fact that having in-house billers or in-house revenue cycle management people, yes, they can manage some volume and submit your claims, but keeping up with the ever-changing guidelines by the insurances, all of these new audits coming from the insurances, because there's a whole body on the insurances end trying to make sure they make it as difficult as possible for you to get paid. So you, being an in-house biller, can create the charges, submit to the insurance, get paid on your first submission. But if there is something that you have to spend time on, probably negotiate with the insurance, fight for the claim, monitor the underpayments, stay up to date with the HICFA form changes, where to populate what sort of information, you can't keep up with that. You have 25 claims to submit on every day. Yeah. And if you're spending time on this side, that means you're going to miss out on the 15. You only were able to do 10, and you've got a backlog of 15 on the next day. You're starting with 40 to do, and the next day another 55, and next day it's going to pile up to a level where you are going to give it up. So outsourcing is the decision that you have to make. Who to make is the biggest challenge. Who do you want to outsource to? It's very difficult to research a good medical billing company. So that's probably the biggest decision for you to make.
Yeah. Those are some powerful numbers, right? I mean, like shortages at 3.2 million, majority billers and coders, like you're saying. The outsourced billing market will grow to
$39.98 billion by 2032. And this was given by Fortune Business Insight.
Those are powerful numbers. And like you said, it's who do you want to outsource to? There's a lot of work to be done there. What do you guys, do specifically to help practices like choose the type of a vendor, like, and basically improve their performance, right? Like, how do you overcome this of like, who do I choose, right? There's so many RCM options out there in the market. What do you guys do to help those providers and practices?
We have been a bit selective in selecting the groups, the providers that we're going to go for. Obviously, it's a for-profit organization. We'd like to make money, of course, against our efforts. So we select the clients where we see the ROI is, acceptable for us while keeping it realistic, win-win for both parties. Obviously, there are no rip-offs. We're very considerate. We have, at 2024, just in December, we onboarded 25 roughly startup clinics who had no revenue to pay for their credentialing. So we get them credentialed in February without any charge, and then we had them pay afterwards once they started earning the money. So we do support startup clinics as well. But what we do and how we win the trust of the clients when we bring them on board who have been working with 4, 2, 3 different other billing companies in the past, I think the first is we always give them a free audit. So before we even start working on their billing, we do a free audit in which we have defined KPIs. We tell them that your existing billing has these top 5 problems. These are the 4 top revenue leakage factors. Here is your losing money. Here is the list of appointments that was never billed to the insurance because nobody created the claims, or nobody reminded the clinicians that they have to submit the bills or the codes to the billing company to submit the claims. This is a large number of claims that are sitting into the 90 plus or 120 plus of aging buckets, and now they're going to turn into the lost revenue because nobody followed up. Now, these are so many facets of one big system that you do not have the manpower if you're operating from within one. On one particular claim on an average, and you can calculate this, it takes 52 minutes for one biller to wrap up a claim from start to finish. That includes creating a claim, submitting a claim, validating the coding, posting the payment, submitting to the secondaries if applicable, following up with the insurances, fixing denial and rejection. All of that takes 52 minutes per claim. Imagine for a larger practice who deals with 100 or probably 200 claims a day, and one person can only effectively give you 6 to 6.5 productive hours in a day on a 9-hour shift. How many claims are you going to process, and how many people do you need?
No, it's crazy. Yeah.
So we give them the solution, we give them this picture, and obviously we make it cost effective for them as well as reasonable for us to keep the doors open. And then we present them with the kind of reports we give, the kind of visibility they are going to get through us. We always assign dedicated account managers who work dedicatedly with them. They get cell phone numbers. Their availability is strictly for them. So sometimes we do get complaints from our clients that I'm leaving my previous billing company just because they never answer our calls. We send an email, we never hear back. The customer service is really, really pathetic. So we give this dedicated account manager that Mr. XYZ is going to be assigned to your clinic. You'll get a cell phone number. He's going to visit you every now and then, whenever applicable, whenever there is any matter of urgent nature. He can come on site and guide some of the staff members on some of the issues that probably won't be related to the billing side, but still, based on our experiences, we can help you with some matters where we think we have the expertise. On top of that, as we are a very large group, it's not just the billing side we take care of. We also assist with marketing. We also assist with staffing and several other. Virtual front desk is another aspect where we offer people who can act as a virtual front desk, who can, manage your entire scheduling platform, answering calls, sending reminders to patients, helping elderly, connecting through a video link for a telehealth visit, helping patients with intake forms or consent forms or psychometric exams where the patients do not know how to answer a particular question, these kind of stuff. Even collecting co-pays and co-insurances, verifying eligibilities, giving complete benefit check well before time to our clinicians or the front desk if they have in-house, so that they know what they need to collect from the patients up front. Because patient AR is also changing. I received a call the other day. One of our clients said, I have patient AR that is closing up to $500,000. How can you help me on that? I need to send them to collections. So people are aware of the changing horizons. Right now, as of 2025 Jan, you cannot report medical bills to credit bureaus. So even if you send somebody to collection, the collection agencies are not going to threat the patients that you're going to report to the credit bureaus, because that's not applicable anymore. So what you need to do as a clinic, you need to have a robust system through which you make arrangements to collect up front. You need to let the patient know that now we have gathered your information through your insurance verification that you would owe $40 for the appointment that's 2 days after. Do you want to pay now on the phone, or would you like to pay when you come in? So now you don't have to chase the patient afterwards once the claim is processed. So there are some of the revenue leakage factors that you really have to put a tab on, and that's where we help our clients enhance their revenue.
That's huge. That's a great story. From everything you shared, it's clear that you guys provide the end-to-end RCM service, and even ancillary functions that interact with RCM, like marketing, staffing, front desk, like you mentioned. Out of curiosity, because I'm completely with you on the demand on the insurance side being there, even on the credentialing side with the different types of clinicians that a practice has, or have you guys come across these like payviders, where it's the big providers that have their own health plans internally? Because I think as an industry, we could get to a spot where the practices have their own health plans, and they're able to sponsor coverage for patients. Have you interacted with any, like the classic payviders, like your Kaiser Permanentes, your Geisingers? There's a lot of these out there.
We are well familiar with those, but so far we haven't had a chance to, be in that situation. Again, we would be in any situation based on our client's need. If we get a client of that sort, obviously we will get into that as well, but so far we haven't. We are aggressively exploring new options. We collaborate with different service providers who probably cannot independently offer the full realm of services, but they do collaborate with us where they tag in that, okay, this part of the work will handle it for you. Like for claim litigation, we do work with a lot of out-of-network practices as well, which is completely different, and it's totally different domain altogether. There is fair health involved, there is usual and customary involved, there are independent dispute committees, there are prompt pay appeals. So out-of-network is completely different, especially for the surgical practices. So you have to litigate and actually get lawyers involved to get your claims paid at some stage. So since we work with some of the surgical practices where we get that far and we do these disputes for them, obviously we are not legal people. We can't do that. So we have a third party who works with us. So we bring such cases, we try to get paid from the insurances, we get to the negotiations, we do whatever appeals we can do, being a billing company, once it gets to a point where it has to be a peer-to-peer review, some claim litigations through legal, so we subcontract to our third parties who can then help collect through those manners. So yeah, we're always open to collaboration. If it's something that we have not tried, we never shy away. We're always open to it.
Right on. Yeah. No, I was gonna ask you like what are the types of, providers that do benefit the most from a partner like MediBillMD, and you threw out a few of them that were stood out, like startup clinics, surgical practices. How do you like approach earning the trust of these practices in a crowded RCM market? I know you threw out the free audit. How do you truly, as a team, build trust with these practices of, even the ones like you said, startup clinics that don't have revenue to pay for credentialing? How do you earn the trust of a clinic or a practice?
It's funny that you say crowded market. We're rendering services to almost 30, 35 different specialties, almost in 30 plus states. So it's a very wide spread of clientele that we're dealing with. So it's not a crowded market, to be honest. We get customers complaining about stuff that is being sent over to them, and a lot of the work that they have to do, which they assume is billing companies' responsibility. But billing companies, there's so many out there. If you just put billing companies in Google and press enter, you probably get a never-ending list. And in all of those, and majority of those, I should say, offer bits and pieces of services. So they would do just a submission and follow up, and that's it. So if something comes from the insurance, the client has to post themselves. If there is problem in the claim, the client has to, appeal and write letters to the insurance themselves, negotiate themselves, collect patients' information themselves. So I think a majority of the time when we speak with different customers and try to understand their pain points, what they come up with is there's a lot of work that comes to us and we have to do a lot. There is a lot of engagement from our end. So what's the point of outsourcing the billing if you have to have people inside who are also billers? So imagine if you're a solo practitioner, you're just one clinician. If you decide to outsource your billing, what you expect is that you render the services, you provide them the code, and that's it. You get paid after that. But imagine that all of the claims, probably 100 or whatever over the course of a month that you submit it to the billing company, comes back to you asking questions about how to fix it. The billing company is supposed to fix it. So I think the holistic nature of services that we offer is one where we take everything. We define global guidelines. We do a denial review for our existing clients. We give them that in the previous billing, this is the set of top 10 denials that you have been receiving, and these are the ones that have been draining your revenue. And this is what we propose as a solution to those recurring problems. Now, according to our experience of all these years, I personally believe, and this is true, that up to 90 to 95% of denials are preventable. You do not have to receive a denial and then fix it. There are ways you can prevent the denials from happening. So when we are reviewing your previous billing, we are also identifying what are the top 10 denial reasons or top 10 rejection reasons that has been happening over the course of the last 12 months. And here are the proposed solutions. This is how we think this could have been prevented from the first submission. And you could have received the payment in your first submission instead of resubmitting, waiting for 90 days, waiting for 120 days, and ultimately losing all the money. So, and then we get an approval. We call it the global approval. So most often than not, these are well-researched proposals that we make, and the clients do tend to agree to our proposed solutions, and we program them into our scrubber. So we have inbuilt scrubber, even though when you come because we are totally a service-based company, we do not offer a software yet. So if somebody comes from eClinicalWorks will have their own scrubber. So sometimes these practice management softwares do not have a very solid scrubber because they hardly ever get updated. We, being the specialist billing company, will build our own scrubber. And we do have an R&D team who continuously update the scrubbers. Whatever new guidelines come in, we program them in. So when we scrub the claims, we are able to identify any potential possible errors that could come with this claim that could be related to patients' demographic information, their member IDs, their date of births, their coverage information, the type of insurance, the paid IDs associated with the insurance, and then the coding scrub. Is the code according to patient's age? Is it according to patient's gender? Is it according to the place of service the services are being rendered? Is there any LCD error? Any NCCI edits that needs to be overridden? Would it require a 25 modifier? Would it require a 59 modifier? Has the clinician defined the anatomy of the services on the left or right on the body? Stuff like that. So there's a lot of scrub, and that enables us to achieve up to 97% of clean claim rate, which means 97% of the time we are going to get paid in the first submission. Now, the prompt payment statute says if an insurance company receives a clean claim, they are supposed to process it and pay within 30 days. So if you're able to submit clean 97% of the time, Remember, there is another bunch of people trying to make it difficult for you to get paid. So there is that 3 to 4% problems that would continue to happen. But 97 is a decent number. So if you're able to get there
Yeah.
and you're able to get your claims paid in the first submission, that means there's not a lot going into the aging buckets past the 60 days, which is
Yeah.
a very good number. So I think these are some of the points where we really spend a lot of time before releasing the claims out to get that first submission right up there.
Yeah. And those numbers, I mean, they'll trust with your audience too, right? The fact that you guys have that 97% clean claim rate. And I like your point too on like, you're a firm believer that up to 95% of denials are preventable. Like those don't make the practice happy nor the patient happy, you know? So the more, you guys can do to ensure those claims get submitted on the first go round, I think that's a powerful number, 97% that I'm
So
sure.
let me tell you how we get to that 97% clean claim rate and why I say up to 95% of denials are preventable. What are the top two main reasons of denials? One is related to patient's demographic information and the insurance information. That is almost 50% of the possible rejections and denials. So if you ask any clinician, what kind of denials do you receive? They'll say, oh, it's related to patient's name. We just send the incorrect name, or we send the incorrect date of birth, or we send the incorrect member ID, or his insurance was not active, or the procedure was not covered in his policy. So that's like almost 50% of the denial. The remaining 45 to 50% is that the coding is incorrect. So your coding does not justify, for example, if you're a pediatrician where you're dealing with newborn babies or you're dealing with certain age groups. So you have specific ICD codes for patients from age 1 to 3, from 3 to 5, from 5 to 7. So if you do not know the age specificity of the codes, even though the codes are right for the services you're giving, but it has to be according to patient's age. Similarly, there are different codes that are only applicable to a female and only applicable to a male, gender specific. So you got to know these codes, and this is how some of the denials come. The only small percentage of denials are related to some problems that you probably have never seen before. But these two, if you take it up these two, you're right up there. You prevented almost 90% of the denials.
Oh, spot on, man. I love that you have like data to back all of this. I mean, it's a testament to the work you guys are doing. And, because I was going to say, like, even to prove some of these data is like up to 95% of denials are preventable. You could run a research study with some of your current customers or, other practices out there to get to that.
Absolutely. Absolutely.
Yeah. So I want to ask you that because I know we spoke about this a little bit. What do you see as like the next frontier in like RCM and the whole billing space? Is it more automation? Is it AI? Is it deeper integration with EHRs like Athena? Your big ones like Epic. What's that next frontier in your mind?
I think there is something that needs to be fixed. We are making big inroads into the technological advancements, but there is huge problem that we have not fixed yet, and that is data security. We had a massive breach in 2024 with Change Healthcare.
Yeah.
If you've heard about it, that was so huge that it shook the entire industry. I was working at the time with a different company consulting. So there were almost 100 plus customers for that particular company only who had no access to their patient documents, who had no access to their appointments. There were cards on file. The ERAs were not coming. The claim submission wasn't happening. The entire system, the entire industry was shut down. Remember, Change Healthcare is one of the biggest clearinghouses that connects with almost every insurance that's out there. That is every other EMR that's out there. Now, we just gone past that, and now we have, and I was reading this a day or two before, there is something with Blue Cross California, I think. And what they've done is they have accidentally, so to speak, in quotes, accidentally, they have leaked the patient's data, thousands and thousands of patients' data. Blue Cross is a very large group to Google Ads. Now, all of these patients are receiving targeted advertisements based on their research of the medication they have ever searched, based on their specialty type of doctors they have been searching, based on the DMEs they've been searching. They're receiving these, targeted marketing ads. So data security is a huge problem. AI is great. We're making huge advancements. We're bringing in platforms, cloud-based EMRs, ability to store patients' records and make them available across the country, no matter what state you're in. Commonwealth is a big example. Commonwealth connects several different EMRs through which you can access different patient history and stuff if you're part of that Commonwealth program. No matter what EMR you're using, and if the patient is coming from out of state, you have access to it. But are we protecting that? Is it limited to the permitted use, it's been very easy for hackers to get in and steal this information. So I think this is probably one front. Before we make any more advancements, we need to make it secure. That's probably one thing I'm really concerned about.
Yeah, right on. And yeah, data security is not even something that just impacts clearinghouses and insurers, but the health systems themselves, there's been many data breaches, with big hospital systems, right? So that's always a priority and shouldn't be taken lightly.
Okay. It's 2025. You need to put a stop to it. That's all I'm
Right.
trying to say. Yeah.
So, Fred, what's next for MediBillMD, and how can interested practices that are listening to this, all the way from startup clinics to specialty practice like ortho, how can they get in touch with you?
We have our websites, of course, and I can put in my email and the phone numbers. Everything's published, of course. We do targeted campaigns as well, so we're pretty visible even on the internet. If you just do best billing companies, we should be listing somewhere in the top 3 or at least in the top 5. Pretty easy to find. I'm on LinkedIn. You can follow, but I also want to throw it out there that very soon, and we're working on it already. MediBillMD is coming up with their own EMR in about a couple of years. We're in the development phase. So we, yeah, working with different billing companies has made it very easy for us to identify those areas where we could really bring in improvement, which is why we've been able to offer that holistic approach of revenue cycle management. And the same is the case since we're right now a service-based company. We're currently working with several EMR and PM systems. So we know one of the goods and one of the bads in
Right.
EMRs. And I think when MediBill sends out their own EMR, it's going to be probably one of the best, at least covering all of the known problems with different EMRs, because we have access to all of them and we work on all of them. We are in the certification phase. We're in the licensing phase. A couple of years from here, we'll be publicly launching that. That's next for us, and we're really looking forward to it.
That's amazing to hear. Can we get a sneak peek or a preview on what type of practices will be the first to benefit from an EMR like that?
So we are going to test it with our existing clientele. This is an opportunity for everybody who wishes to join us. Any practice who's going to be on our panel at the time when we hit live with our EMR and PM system, we are going to give at least a quarter free subscription for them to test out, and we will have a full developmental team at their disposal where they can ask for customized features that they would need for themselves only. So not only you have a brand new EMR to work with, you have that free for a quarter, plus you have a development team who's ready to listen to your particular needs in that EMR and develop the solutions that suits your need.
I love that. Yeah, that makes for great promotional content. We'll have to drop that in the post or the description about the new EMR coming. And if you get a chance to be on the panel, you could get a quarter free subscription. So that's amazing to hear. And Fred, really enjoyed our conversation today. Can tell you're someone that's gets energized by this type of work, and you're leading. You guys are clearly a leader in this space, and excited to keep in touch with your guys' journey. And it was a pleasure having you on the podcast today. And yeah, thanks so much for your time today.
Pleasure being here, sir. Thank you very much, Bert.
Thank
Love
you.
talking to you.
Likewise.